Good evening. I greet you on this Friday evening, ANC Friday, hoping that you've had a good week. Um, this evening we have a very, very interesting leader with us, man from the Western Cape, but from the Boland area, from the Wellington area. One of our veterans, but he's also a member of Parliament, Dr. Kenny Jacobs. Dr. Kenny Jacobs is a former member of the Provincial Executive Committee of the ANC, but he's also a leader in the Veterans League, and very importantly for our purposes, he's the chairperson of the Portfolio Committee on Health in Parliament's National Assembly. But even beyond that, he's been working on issues around public health for a number of years. Dr. Kenny, how are you doing this evening?
Very good. Thank you, Khalid, and good evening to everyone. And thank you for having me on this podcast this evening.
Excellent. It's good that you are with us, and we want to tap into some of your wisdom. Dr. Kenny, before we get into the subject matter of the national health insurance, which has been much talked about and debated, one of the ANC's flagship policies, can you maybe just for the benefit of our viewers, tell us a bit about your political history, very, very briefly, and where you're at now?
Well, I schooled in Gqeberha, which was then Port Elizabeth. I schooled also in a small town called Somerset East, my first 2 years of schooling. It's a small town, and one could see the inequalities in the system and the social injustices. So that had already provoked me to want to be an activist for social justice. Then, having gone to school and matriculating in Gqeberha, I joined the African National Congress then. That was the 1976 matriculants. And I was a liaison between the schools in the northern suburbs and the schools in New Brighton and Zwide, Khosekele. And so from then onwards, I came to university. At that time, we were forced to come to certain universities, which was then University of Western Cape. I moved on to University of Cape Town, University of Stellenbosch, University of Pretoria, and I had obtained degrees from all of them. But at the center of all of that was my activism, my participation in the liberation struggle as an Umkhonto weSizwe combatant and trained and person who was assisting with getting people to exile and furthering the aims of the African National Congress and, of course, the aims of the liberation struggle. From then onwards, after I had to leave South Africa on 2 occasions, and once the last one was to Namibia, which was then Southwest Africa, where I was assisted by SWAPO to do certain work, and then also to further my studies. After which, having completed it, I went back to Paarl, Wellington area, where I was deployed in 1980 as an MK operative to initiate and further the work of the underground structures, where we had then recruited many young people and sent them into exile for training. And I'd stayed there ever since.
Wow, thank you. That's I think for our young people especially, to be able to relate and to see that spirit of activism from a young age. Within that context of the spirit of activism, tell us a little bit about what do you do as we hear these terms, you're a member of Parliament, but you a chairperson of the Portfolio Committee on Health. Just tell us briefly, what do you do? What does that entail?
Well, just as an opening shot, contrary to what many people think, we actually work very hard at Parliament. I want to put that out.
And you're a medical
clearly.
Doctor as well,
I'm a medical specialist.
Okay.
So I also am affiliated with the university. I lecture at the university part-time. And I also am an examiner for medical students before they can become doctors. But apart from that, I am firstly a member of the African National Congress who has been deployed to serve at the National Parliament, in particular now as the chairperson of the Portfolio Committee on Health. What we generally do are three things. We deal with any legislation that is new legislation that is brought to Parliament, and so we have to process, and it's called a bill, and we have to process the bill, which we have different processes for. And then secondly, we do oversight over the executive, would be the minister, the ministerial ministry, and of course the National Department of Health, but also other departments, provincial departments of health, all of the entities which resort under the National Ministry or the National Department of Health. And then of course we do also outreach within our constituency where we do education of people.
Excellent.
And we further the aims of the National Parliament and holding people accountable.
Excellent. Thank you, Doc. Within that context now, around furthering the public interest. Now, I know that there's a lot of talk around the national health insurance, particularly here in the Western Cape. We know it has caused quite a bit of consternation, driven propaganda. Groups like the DA, the Freedom Front, I think the Western Cape government here is in opposition to this bill. But we, as the ANC, obviously see it as one of our flagships. Tell us briefly, what is the NHI, Dr. Kenny?
Well, simply put, it's a health financing system. It means that where now financing is really open to two groups. It's the public health and the private health, where we don't have really control over the private health system. We're saying, let's pull all of the funds which are available in South Africa. Let's make it one purchaser, one group, which is at a national level that decides on how money is obtained, and secondly, how money is spent in order to give the best quality services to the people of South Africa. Meaning all people of South Africa would be able to have an opportunity to access good quality healthcare.
And that's quite progressive. I mean, that's what you fought in the struggle for,
Exactly,
many people
yes.
like yourself. So on that basis, what would you say? What are the key principles of the NHI?
Well, firstly, it's accessibility for all people to healthcare. It's based on the understanding that we have that even though we see an increase of life expectancy in South Africa, and then we look at the international trends, so there is an increase in life expectancy, we are of the view that people who do not have access generally to good quality healthcare cannot reach that life expectancy and the target that we set in for us to be able to increase that. So that's the very first one. The second one is affordability, where people don't have to be out of pocket or to experience financial hardships in order for them to be able to access good quality health care. Third one is, of course, social solidarity, where we have many wealthy people in South Africa and we have very, very poor people in South Africa. And we're saying that when it comes to healthcare, it's a public good, it's not a marketable commodity, and we should be able to get all people to be able to access that healthcare. And those who are wealthy should be able to subsidize those who are poor. Those who are young should be able to subsidize those who are older. And those who are healthy and economically active should be able to subsidize those, contribute towards it. The next one is, of course, equity. So if we see currently in South Africa that the gap between the haves and have-nots are becoming so much wider. So in other words, inequity is increasing. And in order to be able to bring equity to all people, we should also be able to bring good healthcare to them and hope for a better life, an opportunity to be able to access healthcare and know you're going to get good healthcare and that you're going to have a long and healthy life. And then I've mentioned affordability. Just also in terms of the National Department of Health and public health funding, the fact that it is so skewed, the cost at the private healthcare level and the public healthcare level, where the same or even a smaller amount of money is used to provide healthcare to 80% of people, and 20% of people use the same amount or even more on an annual basis to receive healthcare services. And we think that that is really not, we're really not able to afford that. And then, of course, we're looking at making healthcare more efficient by being able to manage the spending and the services which are provided, meaning that there will be a basket of services, and those services and it will be comprehensive services which people will be able to access to get the necessary healthcare services.
Excellent. Thank you so much, Doc. So on that basis, because there's been a lot of opposition, I spoke about the DA opposition, but we've been picking up a lot of opposition on the part of quite a few of the private sector health companies that are in the health space. Now, what is your message to them, particularly with regards to the NHI being able to link to be able to be linked to healthcare as a form of social investment?
Yes.
Can you maybe just shed some light to this? I mean, what's your message to them in that regard?
Well, the history of South Africa is really our challenge where, and you and I, we've experienced this where you've had to really obtain and attain what you have today in spite of what was in front of you. And there were many other people who received advantages and benefits because of who they were. And so us having experienced know that there is a great need out there. And unfortunately in South Africa, it's based along the racial lines. It's based along economic lines. But your economic lines is also is founded on racial lines because of the history of South Africa. And so therefore we would find that those who are economically active or owns the means of production or owns the economy are people also mostly, and I wouldn't say all, mostly are the ones who object to this social investment. Okay. And that objection is really what we need to talk to, where I say to people, but isn't it just correct and fair, and isn't it just morally correct that we should look at what the benefits ought to be for all people, because healthcare is a public good.
Exactly.
It is not something that needs to be purchased.
Exactly.
And so my message to people of South Africa is, do you not want to reconsider and consider the people who really are in need of good and better health services for better health outcome through you not making any or having any objections to the national health insurance?
Exactly. So it speaks to us being a caring society,
Exactly.
Really.
Yeah.
So what we wanted to get a sense then, Doc, is you've spoken about the fact that it speaks to the issue of care, social investment. So who will be covered? Who are they? Just practically speaking, who will be covered by the NHI?
Well, it's all South Africans in the first place. As I said, there is a disparity in our country. There is a great inequality. So now it will be all South Africans, both economically active and economically non-active. Those who have work and those who don't have work. But then also would be all people who are permanently resident in South Africa. It would be refugees.
That's good.
And of course, all children of refugees. So we're not going to make an exclusion.
Ours is not
because of the
xenophobic. We are not xenophobic.
We're not xenophobic at all. And also, but it doesn't mean it's just open to everybody.
Yes,
we must also be clear on that. You need to have that status.
Exactly.
You need to have been qualified for that status through your application.
Yes.
But according to our Constitution and the United Nations Charter, all children should have the right to access health care. Those who then don't qualify would be tourists, would be international students, would be those who have not yet applied or have not received that status. And those people would have to then be able to provide for themselves within the system.
Okay, so how would people register? Just maybe take us through how do you?
So currently the National Department of Health is busy with the process of, and I think they're very far advanced. I know they're very far advanced to develop a registry of all the people in South Africa. Once you are registered, now this is not a year the registration. People are just on the system, and so there should be everyone who is in South Africa and who are eligible should be on that system. And then you'd have to apply for registration specifically for the NHI with a fund, and then also with your service provider.
Okay. No, that's good. That's at least you're giving some practical, because people say, oh no, NHI,
yes,
it's a big thing, but how do we practically, that's important. Now, also getting on the issues of the practicalities, but also we're going to 2024 general elections now.
Yes.
The administration is ending soon, the political administration, particularly at the national level as well as at the provincial level. How far are we with the implementation of the NHI? It's all very progressive. People will argue that no, but the ANC is just dangling a carrot to voters saying, no, we're going to have this thing. But they've been talking about this for a long time. I mean, Doc, you've been even advising ministers over the years on NHI.
Yes.
So where is it now? And when can we see it being implemented?
I've been in a fortunate position to have been working on this since 2009. And in 2011 especially, with Minister Motsoaledi, but also with various programs like the primary healthcare re-engineering, development of the basket of services, negotiations with the general practitioners on provision of services at public health sector. And so I can go through a long list of that. But what it has resulted in, that over time we've been working on the green paper and the white paper and development of those papers. In other words, the ANC had been very serious about this resolution that we should be able to bring good quality or access to good quality healthcare to all South Africans. It's already been a long period coming. And in the last 4 years, the bill had been brought to National Parliament by the National Minister of Health in August of 2019. We embarked on public hearings in October 2019. We then had, that's in all 9 provinces, 3 districts per province. We had then also received written submissions, and we had a long period of oral presentations. We had 338,000 written submissions. And you can imagine how much work that was to work through all of this over that period of time. Exactly. And understanding in between we had COVID, which really made things very difficult for Parliament to function, but for us to be able to meet and process the written submissions. So it was an enormous task, considering that almost 2 years were taken out of our 4 years because of COVID. And it meant that we had a team that was working 7 days a week. I would say sometimes 12 to 16 hours a day. Yet, because of the benefit that we knew, which our people would get, we decided to really put everything into it and make this functioning. So those who are doubtful should really stop doubting that the process having been very fair and correct and thorough at the National Assembly level, you wouldn't hear anybody objecting to the process that we had embarked upon, because as the chairperson of that portfolio committee, I made absolutely certain that we were not going to have comebacks on that process. Now, we've then taken it, eventually the committee had adopted its report on the National Health Insurance. We had taken it to the National Assembly for voting, and a majority of members of Parliament had voted in favor of adoption of the report of the Portfolio Committee on Health on the National Health Insurance. It it was then, after that adoption, was then referred to the National Council of Provinces, which will on Tuesday, as far as if it is still going to happen, which I'm sure it will, which will be tomorrow, there would be a vote on the adoption of the report of the Select Committee of the National Council of Provinces. It would mean, therefore, that the work at the National Parliament would be completed. That bill would then be sent to the President to be assented to after tomorrow.
Excellent.
We're at that stage already.
And that's all the more reason, listeners and viewers, as to why we need to ensure that the African National Congress retains government in 2024, so that it can implement what the President, and then that in the Western Cape, we also have the DA out, the ANC comes in, so that we can ensure that there's synergy between province and national when it comes to implementing this. Would you be correct, Dr. Kenny?
You're absolutely correct. The NHI bill is the biggest bill we've ever dealt with at National Parliament. If you just listen to the number of written submissions which we had received, is because it's that impactful, because it's that important to the everyday people in our country, their daily lives. And so if I was a person, which I am, person of the public, I would understand that in order for me and my family and everybody else in our country to receive good health coverage, I should go out and vote for those people who brought this bill to Parliament in the first place, for those who had done so much work to ensure that it does passes the constitutional muster, that it passes through the National Assembly, and then the next phase is the most important phase, the phase of implementation.
Exactly.
So put your vote where it is required in terms of those who need to ensure that this bill, which then is going to become an act, is implemented, and so that we'll be able to provide those services to everybody.
Thank you very much, Dr. Kenny. Can you maybe give us, maybe then you've summed up a short message in Afrikaans, boodskap, asseblief.
Sekerlik. Ek wil tog aan almal sê dat dit in ons eie belang, in elke persoon se belang is om te verseker dat jy eerstens deelneem aan die verkiesing, dat jy seker maak dat jy gaan stem, dat jy tweedens deur daai stem verseker dat die werk wat ons gedoen het op die nasionale gesondheidsversekering, en dit wat ons in Afrikaans noem, dat jy seker maak dat dit wel geïmplementeer gaan word in Suid-Afrika. Die bereidwilligheid is binne in die ANC en lede van die ANC wat op sekere vlakke geplaas word om sekere werke te doen. Dit is met ons het 'n groot belangstelling in jou gesondheidsuitkomste, maar ook jou ekonomiese uitkomste, en dit is waarom ons hierdie konsepwetgewing na die parlement toe gebring het en verseker het dat ons die werk verrig. So gaan uit, maak seker dat jy stem en stem asseblief vir die ANC. Dankie.
Baie dankie, Doc. Baie dankie.
Thank you.
It's a pleasure. Thank you very much. Just to remind each and every one of you, don't forget to subscribe to our YouTube channel, ANC Western Cape channel. Spread the word and do participate. Do make your comments and we will respond accordingly. Thank you very much.
Manda!